So we'll start with acute management of the injury. This is on the field. You're at the game, you're covering the event, and an athlete takes a blow and goes to the ground. And there's really two distinct differences that we need to talk about. One is the unconscious athlete, and one is the conscious but thoughtfully concussed injury as well. The unconscious athlete is very easy to take care of. If you get on the field and they are unconscious, you must presume that they have a cervical spine injury until it is proven not to be that way. So if they're unconscious, they need to be put on a spine board with precautions. They need to be taken to the emergency department, usually via ambulance, if they're going to be on a spine board, so that we can have that spine evaluated radiographically to clear them. Many athletes come to consciousness and you're already in the process of putting them on the spine board. Once you've committed to that, I think it's probably best practice to continue on with that and carry them on to the emergency department with the spinal board precautions in place. The conscious athlete, much more common to be taken care of, and I think the most important thing is to just stop and take a breath and get out of the environment of the emotion. Sports are emotional. They're emotional for coaches. They're emotional for the players doing it. They're emotional for the fans on the sidelines. And the problem is you need to be objective. You need to be a clinician, not a participant in the sporting event. And it's very important to get yourself away from the environment. Take the athletes to the side, get them away from the bench, take them away from their own teammates, get them away from the coaches, and if you can avoid the sidelines where parents may be yelling and screaming either at you or for the athletes that are still on the field, that works best as well. For collision sports where you wear a helmet, I recommend taking the helmet away. Hold the helmet yourself or give it to one of your partners that's on the sidelines. That way the athlete can't sneak back onto the field if something happens and you need to go deal with another injury or something else that's happening. It's recommended that you use a standardized assessment of concussions on the sidelines. The SAC is a card that you can carry. It goes very much through the details of challenging an athlete to have a good memory of short-term and long-term. There are questions about orientation. There are concentration questions where they have to do things backward. We'll give them numbers, we'll give them words, and they have to feed them back to you. Even the months backwards, starting in December going to January. Those are all ways that you can document and actually score how an athlete does on the sidelines.